So today is the third day of radiology. So today we will discuss about CT scan, basics of CT scan. Okay. Good evening. So CT scan is a machine in which 1 second, please. So this is the CT scan machine. Okay. So basically, CT scan machine having one side X-rays, okay, and opposite side as detector. Here we have the detector. Okay. So whenever the patient lying in this area, he will enter. There is a hole. Okay. So which part we want? The patient will slide. Does this slide is move into this cylindrical area? Okay, cylindrical area. So the X-rays will fall down on this particular part of the body, and the detector will detect that and save those images. Okay, save those images. So basically, why we call CT scan? Why the name is given? CT, we know that computer. From T, we know as topography. Okay, why the name is given? So basically, topography. Sorry, not topography. Tomography. Tomography. So basically, you are seeing this image. It has combination of X-rays and detectors. We will get the different angles. It will have the different. It will enter. Okay, you will get different angles, structures of the body. Okay, so there's the reason we will call tomography, because all these images are come together and make one uh, picture film with the help of computer. Okay, there's the reason we'll call this as computer tomography. Okay, so the CT scan, in the CT scan we have, it will take different rays, X-rays, okay, and detect the images, and the images are combined together with the help of computer. So there's the reason we will call CT scan. Okay, and the first thing is that what is the difference between CT scan and MRI brain? Sorry, MRI. MRI stands for magnetic resonance. We will discuss in next class. CT scan, computer tomography. Okay, so whenever a film come to your hand, so mostly nowadays brain scans are going on in large number, because most of the persons are suffering from brain stroke, stroke of the brain, hemorrhagic stroke, due to the numerous reasons we have. Okay, so CT scan, in the CT scan, this is the brain, this is the skull. Okay, we have the skull, this is the protector of the brain. So whenever you saw this white color image, it shows that it is CT scan. The bone is in white color, bright color. So whenever a scan comes to your hand, so if there is bone, so it means that it is white color, bright white color. Okay, this is not only white, bright white color. And if you go to the MRI, the the brain or any part of the body's bone, it will become black or dark color, black or dark color. So from that point of view, you can identify that this is CT scan and this is MRI. Okay, so this is the basic things we have to remember while seeing the scans. Okay, so we have different things which I have to remember. So I will tell you that in the CT scan, whenever you do the CT scan, you will get, we have in the body, we have tissue, air, uh, structures, when we have air, and we have soft tissues. Okay, in our body, you have fat. Okay, we have blood vessels or blood or bleeding, hemorrhage, metal, sometimes bone. Okay, so these are the some important things. Air, if you do CT scan, if you have in the lungs, how it will represent in the scan. So it will represent in blackish color, black color. Okay, soft tissues, gray color, and fat, darker black. Blood is in black color in CT scan, and metal, white color, and bone as well as white color. Okay, so this is called plain CT. Plain CT. I will tell you. We have different types of CTs. Plain CT, also called NCCT. So anywhere where NCCT is non-contrast computer tomography. Okay, this is one type of scan. Another type of scan is that is IVCT or IV contrast CT. Okay, or also called CECT. C is in a contrast CT, means one injection will injected through the veins. Okay, it will go to the area. Okay, and when doing the scan of that area, you will get clear picture whether any problem or not. So whenever IV contrast is given, you will get white color only. Okay, so this is the basics. Okay, so if a person have any issues, like a metal object uh, inserted in the eyes. Okay, so what is the best choice of investigation of choice? Anyone can. Okay. So whenever a metal entered into our body, we want to see the clear picture. Okay, so we'll go through the CT scan. NCCT is enough. MRI will not do. Why? Because there is a no clear picture. Second thing is that MRI is contraindication because that is metallic substance. MRI have magnetic power. It can attach the body. Okay, so that's the reason we will avoid MRI. Okay, so NCCT is the best option for any metallic damage into our body. And we have another thing that is calcification. Stones. For stone, what is the best is, okay, either NCCT or CECT, which is the best. So if you want to clear picture of stones, which is the best scan? Okay, Canival.
CT scan only, sir.
Okay, okay. So basically, CT scan is okay. If you want to measure the amount of stone, it also available in CT scan also, but and CECT is the best option. You will get that is substance, hard substance. You will get picture of that. Okay, but in gallbladder stone, okay, mostly the investigation of choice is plain CT. Okay, so whenever a patient have this thing like gallstone, bleed, acute bleed, these are the shortcuts I am writing. Fracture. Okay, so in this condition, you will go through NCCT, that is non-contrast computed tomography. If the patient have inflammation, any inflammation like irritable, you have diverticulitis, bowel problems. Okay, so in that condition, you will go through CECT, inflammation or tumor, any type of tumor, infection. Okay, in this all this condition, you need to do CECT for correct problematic approach. So, so you learn about basic things related to CT scan. Okay, and whenever the CT scan images come to you, they have three positions, mostly three positions. One is coronal position, means the scan, what it will do, it will cut down the part by images, by taking images in three things, three planes. One is from anterior to posterior, it will cut down like this, like this, like this, like this, slices. Axial, like this, like this, like this, like this, from upper to lower. Axial, from here, okay, like this, cut into pieces, and from upper to lower, from side to lateral to medial. So what we will call coronal plane, will call axial plane, will call sagittal plane. Gas. Anterior to posterior. This is how from front to back. It will continue. We cut the potatoes in the slices. Likewise, it will cut the parts of the organ. Okay, axilla perpendicular. Okay, and sagittal lateral to medial, or also horizontal. Okay, this is the thing we have to remember. The planes. This is the planes. Next is we have different types of scans other than CT scan. Not it is included in the CT scan. Okay, but they use high resonance, high resolution. In that, I think you heard about that. That is HRCT. HRCT is also a CT scan only, but here high resonance computer tomography. Mostly it is advised for lung or chest. Okay, mostly you heard during the COVID. Okay, the doctor advised mostly HRCT to completely see the internal structure of lungs. Okay, now we have simple things we have to remember. So HRCT, when we use for lung pathology, okay, for lung problems, number one. First, second is paranasal sinus. So if anyone have sinusitis, any issues of related sinus, so the first investigation of choice is HRCT, PNS, paranasal sinus issues, and the third is any issues of temporal bone. Okay, okay, temporal bone issues. You can go through the HRCT. HRCT is the investigation of choice. So this is the important thing we have to remember. Now is we have different types of CTs will do, like for renal renal CT to see the internal structure of uh, kidney. Okay, mostly we have medulla, cortical, and in the kidney you have the different structures. So to see the mostly lower abdomen CD means to see the internal structure of kidney. Next, sometimes we need CT urography. CT urography. In that we have kidney, urinary bladder, urethra, or pelvic bone. Everything will come to see the complete urinary system and pelvic organ to condition of the patient. So mostly here, to understand the renal pathology, they will go through the uh, CECT. So you have to understand what is CECT. You have to, you can write in the chat box also. What is CECT? Okay. Next is for to know the condition of the heart. To know the condition of the heart also, doctor advise CT cardiac. CT cardiac means pathology of the heart, chambers of the heart, coronary vessels. Okay, coronary vessels. So this is the mostly advisable scan, CT cardiac scan, MRI cardiac scan also to be done. So these are the important scans to be done for the understanding of pathology of the particular organ. So understand what is CT scan. Yes, yes. No, CECT. Okay, contrast. Good. Contrast based scan. That is CT, CECT. So what we studied today, what is CT scan, how the name is given, computer topography. Okay. Next is what are the how the CT scan shows internal things like air, it is black color, soft tissues, gray color, fat, darker color, blood, black color, metal, white color, bone, white color, IV contrast, white color. So let's see one image here. I will type here. One is CT brain hemorrhage, hemorrhagic stroke. Okay, let's see that. So we wrote here that blood is in black color. So let's see one image regarding that. We can see that So this is one image you can see here. Okay. So basically, not black, dark black. It is lighter version. Okay, lighter version of black. So, so if you go, it will become like acute bleed. It will initially sees like white in color. So gradually, when time happen, it will become chronic condition. Later on, the color also changes. So you can identify the disease very chronic and old stroke is happened to the patient. So basically, we have two types of stroke. That is, one is hemorrhagic stroke, and another one is ischemic stroke. Ischemic stroke, hemorrhagic means bleeding in the brain. Any artery, what happened due to the excess amount of pressure in the brain, in the artery of the brain, it blast happen. So then the bleeding happened from that area, or else due to the injury, accidental traumatic injury. Okay. So what happened? The pressure, due to that pressure, any part of the artery got leakage. So it enter into the brain parenchyma. Okay, brain tissue. So that is called hemorrhagic stroke. In ischemic stroke, what happened? The we have arteries, mostly arteries. Blood have to be flow, okay, and reach to the part of the brain. Okay, what will happen? Any clot is deposited here. The clot maybe come from the heart, or from the carotid artery, or any part of the body. Okay, or else it itself develop in the brain. Okay, like sugar patients or long term uh, cholesterolic patients. Okay, so it is deposited here, so the flow is obstructed. So certain area of the brain is not allowing the proper amount of blood flow. Oxygen is reduced, and mostly glucose is reduced. Okay, and nutritions are reduced. So means what happened? The part of the brain is started dying. Okay, damage is happening. Okay, damage is happening. So this is called ischemic stroke. Okay, so this is all about for CT scan. Tomorrow we will discuss about MRI. So MRI is very important. Tomorrow we will discuss MRI basics. Then we have ultrasound basics. Okay, then afterwards we will discuss gastrointestinal radiology, how to study gastrointestinal radiology. Gradually, we will learn one by one organic or organ based radiology. Okay, so thank you, everyone. If any doubts, kindly ask.